in Pampa, I was just telling you, this woman came up to me at the end. She wasn't part of our
get-together,
but she was at a table nearby and was overhearing the conversation. And so she came up to me and she said, your husband's busy, but I am a diehard Republican. And was really upset about Obamacare and saw no other solution except for to repeal it and start from scratch. And so we kind of got into a conversation about it, but I was telling you I didn't feel entirely confident about my responses. And she was saying that countries like Canada have single payer and that's not working, and that if there's other government-run operations like the Postal Service that are not fully efficient, how can we trust the government to do single payer? And I didn't really know how to respond. And Michael just asked a question on here and said, can you please explain what single payer means?
Yeah.
And so that kind of goes back to the conversation we were having a minute ago.
Right. So, here's the way that I think about it. Medicare is a single payer. So you're 65, 67, 70, 75, 80, 90 years old. And when you go to the doctor, Medicare is the one payer that you really have to worry about. Now, your doctor may have other payers that reimburse the services that he provides, but it is government-run insurance that reimburses the doctors and the providers for the health care that you receive. And it is pretty popular, not without problems, not without some fraud or abuse or inefficiency, but it's a hell of a lot more efficient than the private sector. And it flies in the face of what we assume about government sometimes. But más o menos, the overhead administrative cost for Medicare is around 2%. Everything else goes to the provision, the reimbursement for the provision of care. For a private insurer, the overhead, including expenses related to profit and taking care of advertising and all of these other things outside of reimbursing doctors and providers for the care they provide, is like 15%. So to the woman's question about, look, government can't get anything right. I'm unhappy with the post office. So how can I expect them to handle insurance? Government is doing a pretty good job when it comes to Medicare, which is insurance, and Medicaid, which is insurance. And those customers of Medicare and Medicaid, the Texans who are enrolled in those two programs, by and large, are pretty happy. Not perfect and not perfectly happy, but pretty happy with the kind of service and care that they are receiving. So when we talk about a single payer, we're talking about ensuring that every American, not just those 65 or over for Medicare, and not just those who meet a certain threshold when it comes to poverty or income, is able to have a program that is the one program that they and their doctors and providers need to worry about, that pays for their medical bills, going to see that doctor or that dentist or that psychiatrist or that psychologist or that therapist or that rehabilitation specialist, so that those providers are not trying to negotiate different rates with Aetna and Blue Shield and all the different insurance programs. They're just worried about taking care of their patient. And the patient is not worried about, does my income allow me to afford this insurance? Does this insurance truly cover what my family needs? Is it going to be too late that I find out that the deductible is not affordable? I bought this insurance, it was cheap, I could afford it, only to find out I had to spend thousands of dollars out of pocket before the insurance ever kicked in. Or only to find out that over time, as premiums rose, I couldn't afford to keep that insurance anymore. I don't want families in Texas to decide, as somebody at the breakfast told us they were having to do, between being able to pay for medicine, to see a doctor, to take care of their kids or their folks, and putting food on the table or paying the mortgage. I want them to focus on going to school, going to work, taking care of their families. And the only way that I can see that you get there is through a single payer, where doctors are focused on taking care of their patients, folks are focused on getting healthy, and you don't have insurance companies and pharmaceutical companies calling the shots, in part through the talk about access, the access that they have purchased from the members of Congress to whom they contribute those PAC donations that have created the most convoluted system in the world. And so the person you spoke with talked about Canada, talked about other single payer systems. There are dozens of different examples of single payer throughout the world. Some are better than others. I'm confident that the strongest, most innovative, wealthiest country that the world has ever known can figure out the best way to do this. And I think that Texas, of all the states in the union, can be the leader in listening to our doctors, our patients, and the people who have the most to gain or to lose on how we take care of each other in this state and in this country. And last point is that how can this country hold its head high when the people in this country do not have the best healthcare outcomes? We don't have the best performance. Even though we spend the most on healthcare, we don't have the best healthcare outcomes and results. In other words, we're losing lives that we should be able to save. People are sicker than they should have to be because we haven't found the system that will allow them to be as healthy as they ought to be as Americans and Texans. So that's the way that I would approach that issue.